We launched our strategy at the beginning of the year, and that's gone down exceptionally well, and we're continuing to review and refresh that. We're also making sure there's a really golden thread between our 6 strategic objectives and everything that we do in the organisation. But importantly, 2 things. Patients remain at the very heart of what we do, and staff are our best asset, and we really do need to nurture and support and reward our staff at every available opportunity. They do a fantastic job.
We held our second research conference, which was fantastic. Speakers from carers and patients by experience with academics and professionals. We've also appointed a patient and carer experience manager, and I'm particularly excited to see the work roll out across the trust under her leadership. And it's great to see patients, carers and staff working together to co-design a strategy, but more importantly, agree on the priorities for the next year.
I suppose the main highlight of certainly my year, and I'm suggesting the whole of the organisation, is the CQC report. What a fantastic achievement to get good overall in such a short space of time, and that's fantastic.
So one of the main projects that we worked on was the development of the garden at Granville Court up at Hornsey. We're involved in the dementia-friendly project at Maester Lodge. We've taken on lots of challenges. We've seen the Willoughby to Whitby bike ride, which was fundraising for the Humber Centre. We've done lots of work across therapeutic groups with allotment groups and gardening groups for community mental health. So it's really been a lot of positive work going on.
The leadership programme was commissioned just before I started, and it's in its second cohort now. The first cohort has just completed a couple of months ago. Ran as day sessions once every 2 months for a year. So people attended 6 different sessions on different subject areas. We had keynote speakers from across the region. So we had people like the CEO of the City of Culture coming to talk about their experience of leadership.
The health improvements course has gone really good this year. We had a lot of interest and the patients didn't want it to end. We are hoping to carry this on over the summer into next year, and we've got a lot of interest from a few more patients, and hopefully we'll get a lot of them joining the course.
The Department of Psychological Medicine, we've been awarded just short of £700,000 by NHS England. We've set up a new service for patients who attend A&E frequently with mental health problems. In addition, the new funding is to allow us to deliver a treatment service for patients who self-harm. We haven't done that for many years.
Initially, I was visiting places, visiting anywhere where there was footfall of older people, to talk about the project and encourage them to come forward to take part in the research.
So we have 3 courses that run on the internal training diary that are to do with supporting people with learning disabilities, communication and swallowing needs. We've been able to train the whole central PCSO team in how to support the communication of adults with learning disabilities, autism or mental health. We've been able to train the children's learning disability team in Lego therapy, and we've also been able to train the East Riding GPs in terms of the annual health checks that they offer for people with learning disabilities.
We've trained up staff members within the last year, and they have trained up patients and carers how to manage an opioid overdose and then give take-home naloxone to save that person's life. We've actually taken that training that we've done and evaluated it. It was successful.
We've been able to support young people and re-engage them back into education. A couple of young people in particular I can think of, they were currently round about sort of 20% attendance at school, through the work through the SMASH programme and the group work element, as well as some of the one-to-one work and the family outreach. Both of those young people are now actively back in school, and one of them is reaching 100% attendance and has actually just completed his GCSEs.
Within the governorship at Humber, we've got an element of challenge, which is really positive. I think when the CQC came to visit us, I think one of the things I was most proud of was the collectiveness of the governors. I think we all recognised exactly where we were as a trust. We recognised the journey we was on, and most importantly, we recognised that it was a success journey, but we're going to take a few stops before we get to our end destination.
One of the biggest pieces of work that I've been involved in is developing the strategy for the trust. We held an event on the 14th of February of this year where a group of people came together and we identified 12 priorities from that event which have shaped the strategy.
So we've introduced a new clinical system on System 1. We've also introduced on the 1st of May a new call centre. all the calls for the community services now go through the customer access service.
Humber gave us the actual tools and impetus to turn the practice around. By September 2017 we had our first CQC inspection under Humber, and we had improved from requires improvement to good in all areas, which was an absolutely excellent achievement for any practice.
I think actually the staff have done really well. I think that for a lot of admin staff it's actually improved their skills because they've learnt the expansion of existing skills.
So we've got lots and lots on, lots and lots to do. We've had a very challenging year. It's a difficult year out there, but I thank every single member of staff for all the work that they've done over the year. You've worked tirelessly hard to achieve all the fantastic things that we've done. We've still got a journey to do, and we'll continue to do that. But thank you for putting the patients at the very heart of what we do. And remember, everybody's involved in patient care, everybody across the organisation. I'm proud to work in Humber. I'm also proud to work in the NHS as we celebrate the 70th anniversary of the NHS. Thank you all. Let's have a fantastic year going forward as well.